Welcome to the deep dive. Today, we're really getting into collateral ligament injuries of the knee, your MCL and LCL.
That's right. We've basically boiled down the key stuff from revision notes.
Exactly. The aim here is to give you that solid understanding you need, fast. So if you're revising MCL and LCL injuries right now, well, you're definitely in the right place.
So let's define it first. A collateral ligament injury is essentially damage or a tear to either the medial one, the MCL on the inside, or the lateral one, the LCL on the outside of your knee.
And their main job is stability, right? Keeping the knee steady.
Yeah, absolutely. They provide that side-to-side stability. Injuries usually happen from, trauma, maybe a really forceful or awkward movement, or just putting too much stress on the ligament.
Okay, let's dig into those causes a bit more. What kind of things actually lead to these injuries?
Well, often it's a direct hit to the knee. Like think of a tackle hitting the outside of the knee. That can injure the MCL.
Right.
Or forceful twisting, maybe hyperextending the knee. Sudden changes in direction are a big one too.
So the classic sports stuff.
Yeah, basically anything that really strains those ligaments. The memory tip is good here. Twists, turns, and tackles covers a lot of it.
Twists, turns, and tackles.
Got it.
So who's most at risk then?
People playing high-impact sports, definitely rugby, American football, things like that.
Makes sense.
Also sports with those frequent sharp changes in direction, soccer, basketball, netball.
Okay.
And maybe less obviously, sometimes it's down to improper technique or, not quite the right training.
Yeah.
And having a previous knee injury definitely bumps up the risk.
So thinking about you listening, do any of those sports or risk factors resonate with what you're studying or seeing?
Yeah.
Now, how does the actual damage happen inside the knee, the mechanics of it?
Okay, so for the MCL, the medial one, it's usually what we call valgus stress. That's a force pushing the knee inwards from the outside.
Okay, stretching the inside ligament.
Exactly. And for the LCL, the lateral one, it's the opposite. Varus stress, a force from the inside pushing the knee outwards, stressing the LCL. And the injury itself can be, well, a whole spectrum. From just a mild stretch like grade 1 to a partial tear or even a complete tear, a grade 3. Think of it like stretching a rubber band.
Yeah.
You can stretch it a bit, it goes back. Stretch it too far, it might get permanently looser or could just snap completely.
Good analogy. Okay, so someone presents with knee pain, maybe instability. What else needs to be on our radar? The differential diagnosis.
Yeah, you always need to think broader. It could be other ligaments like an ACL or PCL tear.
Cruciate ligaments.
Or meniscal tear damage to the cartilage pads. Could be a patellar dislocation where the kneecap pops out.
Yep.
Or even an actual fracture around the knee. Sometimes it's just more general knee instability.
So the tip is to think. What else is in the knee that could cause similar symptoms? Don't get tunnel vision.
Precisely.
And how common are these specific collateral ligament injuries? You mentioned sports.
Specific UK-wide data is a bit tricky to pin down, honestly. But we know they are pretty common, particularly in those sports activities we talked about, the high impact, the quick turns, very frequent in sports medicine clinics.
Okay, so someone suspects they've done this. What are they likely to tell you? What are the classic signs and symptoms?
Typically, they'll have pain right over the injured ligament, on the inside or outside of the knee. There'll likely be swelling in that area too.
Yeah.
And it'll be tender if you press along the ligament line. A really key symptom can be instability, a feeling that the knee is loose or might give way.
Right, that side-to-side looseness.
Exactly. And depending on how bad it is, they might find it difficult to put weight on that leg. But remember, the severity really influences how dramatic these symptoms are. A mild sprain might just be some tenderness. A full tear is usually much more obvious.
And how do we confirm it? Investigations.
Well, first step is always a good clinical examination, checking the range of motion, feeling for tenderness, and specifically testing the stability with Valgus and Varus stress tests.
Applying those forces gently to see if the joint opens up.
Yes, comparing it to the uninjured side. Then, imaging helps confirm things. An MRI is usually the gold standard to see the ligament itself, assess the extent of the tear, and check for other injuries like meniscus or ACL tears.
And x-rays.
X-rays are useful mainly to rule out any fractures, especially if there was significant trauma or if the tenderness is overbone.
Got it. So diagnosis is made. What's the management plan?
It really depends on the severity. For mild to moderate injuries, grade 1 or 2, it's often conservative. We use the RICE principle.
Rest, ice, compression, elevation.
Exactly. Remember, RICE is nice. Plus, pain management, maybe some anti-inflammatories. Physiotherapy is absolutely key for regaining strength and stability. Sometimes a knee brace is used for support during healing.
Okay, and for the bad ones? the complete tears.
For severe grade 3 tears, especially LCL tears or MCL tears with significant instability, or if other structures like the ACL are also damaged, then surgery might be on the cards. That could be a repair or a full reconstruction of the ligament.
And rehab is crucial regardless.
Oh, absolutely vital. Whether it's managed conservatively or surgically, a structured rehabilitation program is essential to restore function and prevent re-injury.
Makes sense. What about the long-term outlook? Prognosis? Any potential complications?
Generally, the prognosis is good, especially with proper management. Mild to moderate injuries, grades 1 and 2, they typically heal well with conservative treatment. Most people get back to normal activities.
Back to the gurging.
Yeah. But with severe injuries, or if there are associated injuries like ACL or meniscus tears, the recovery obviously takes longer. There's potentially a higher risk of some residual instability or even getting injured again down the line.
And long-term.
There is a slightly increased risk of developing osteoarthritis in the knee later in life, particularly after significant injuries or if instability persists. So early diagnosis and getting the right treatment promptly is really important for the best outcome.
Okay, great summary. So we've covered the definition, the causes, remember those twists, turns, and tackles, the risk factors, the pathophysiology with valgus and virus stress, the differentials, epidemiology, how it presents, investigations, and management, from rice to potential surgery, plus prognosis.
You covered a lot of ground there.
We did. So here's a final thought. Considering how vital these ligaments are for that minute-to-minute knee stability, how might even subtle, seemingly recovered collateral ligament injuries potentially impact long-term knee health and athletic performance, maybe in ways we don't always fully appreciate? Something to think about.
Definitely something there to consider.
Hopefully this deep dive has given you a clear, concise understanding of collateral ligament injuries for your revision. And don't forget, for more fantastic MSRA resources, check out paspimsra.com and freemsra.com.
They're great sites.